My name is Missy Lucas, and this presentation is about Parkinson's dementia for Nursing 341 Patient-Centered Care. Dementia is defined as a progressive degenerative brain dysfunction, including deterioration in memory, concentration, language skills, visual-spatial skills, and reasoning that interferes with a person's daily functioning. Although many of the elderly are diagnosed with dementia, it is not considered to be a part of the natural aging process. There are several types of dementia seen in older adults, but this presentation will focus on Parkinson's dementia. I will discuss the risk factors, pathophysiology, the signs and symptoms, and the diagnostic tools to obtain an accurate diagnosis of Parkinson's dementia. Risk factors. First and most important risk factor is that you must be diagnosed with Parkinson's disease, which is a neurodegenerative disorder that leads to progressive deterioration of motor function. This is due to loss of dopamine-producing brain cells. Parkinson's disease is known for stiffness, tremors, shuffling gait. Dementia is a secondary symptom of Parkinson's disease. Dementia will be diagnosed at least 1 year of being diagnosed of the Parkinson's disease and is known as Parkinson's dementia. 50 to 80% of patients that are diagnosed with Parkinson's experience dementia. Risk factors also include age. However, early onset can occur. It's typically with older individuals of 65 or greater. Presence of hallucinations and having mild cognitive impairment. And the last one is postural instability, when a person has that freezing mid-step. Pathophysiology. The changes in the brain that take place in order to be considered Parkinson's dementia are abnormal microscopic deposits composed of a protein that's called alpha-synuclein. The protein is also known as Lewy bodies. This protein is also in other brain disorders, including the Lewy body dementia. In many cases, patients that are diagnosed with Lewy body dementia are actually first diagnosed with Parkinson's dementia just due to the presence of that protein being there. Signs and symptoms. Patients with Parkinson's disease dementia may also present with deficits in language, function, and verbal memory. You may find that they forget how to talk or have difficulty trying to find or verbalize words. Psychosis may occur in approximately 40% of patients with Parkinson's disease, and it is linked to underlying dementia that might not yet be diagnosed. As the disease progresses, psychosis is formed into visual hallucinations of animals or of people. Depression, irritability, and anxiety, sleep disturbances, and a lot of daytime drowsiness is a big symptom of the Parkinson's disease dementia. Assessment. When a patient has been diagnosed with Parkinson's and begins to have changes in their ability to think, they may order an MRI, which is a magnetic reasoning image, to rule out any tumors on the brain or other possible structural changes. MRI studies show patients who have Parkinson's disease with dementia have atrophy of the parietal temporal lobe, the entorhinal cortex, the hippocampus, the prefrontal cortex, and the posterior cingulate, unlike Parkinson's disease without dementia or healthy controls. Parkinson's dementia has no cure at this time. There are some medications that may help with symptoms of Parkinson's and dementia that may slow or stop the progression, but there is currently no cure. The disease will progress, and it varies with each individual. Thank you, and have a good night.